How do I feel? I feel phenomenal. I can say I haven't breathed this easy and this well. I've been on oxygen for steady for 6 months, and this is 6 days now that I've been without it. And I tend to ramble a little bit. I don't breathe right as I've been instructed, and I'm learning, but my breath is there. I can recover from things instantly. Yeah, this is a tremendous blessing. I'm taking it one step at a time. I'm just doing simple things. I haven't been able to go for a walk further than 10, 15 feet without sitting down in, say, 6 months. I haven't been able to walk a mile in probably 5 years. It's just the disease slowly degrades you. It doesn't hit you overnight. It's not like you get a bug and the next day you're sick. It slowly builds up to this point. And even in January, I knew that things were starting to fail even more, because the things that I was using to help to breathe weren't having the same effect. And so condition only gets worse with this.
We do have other patients on the waiting list, and we continue to evaluate more, and we'd like to encourage pulmonologists throughout the region and beyond to look at their patients. If they have patients who think they may be suitable candidates, to refer them for consideration. This is a procedure generally, it's increasing throughout the country. Last year there were nearly 1,800 transplants performed nationwide, and about 30 to 40 were done in the state of Michigan. But I think that there's probably more patients that could benefit from it.
Single lung transplantation technically is not very complicated procedure. It can take even less than that, but obviously there's preparation, and actually 2 of our anesthesiologists just walked out and they were part of the team, and they obviously contributed a lot. So they have to work on the patient. Dr. Wilton, who came, she was particularly recruited to help with lung transplantation program here. And Dr. Palmer, they were the anesthesiologists, and also I had Dr. Hooker, the part of the surgical team that unfortunately he's away and he couldn't be here. And we had Dr. Murphy that had to go and get the organ, and with Dr. Timek. So this is a part of this team, and is quite extensive team. And the preparation when they go to the OR, it takes for some time. And also at the end of the operation, also there are sort of parts that is not actually part of surgical procedure. So the surgical part of it can take between 4 to 6 hours.
The availability of lung transplantation is really an important medical procedure for the community. It's growing in volume throughout the nation. It can be a life-saving procedure with patients with a variety of end-stage lung disease. And previously, the nearest programs were on the east side of the state or in Chicago. So that becomes very difficult because the evaluation process is fairly time-consuming. They typically require several visits to the transplant center, and that can be difficult for patients with end-stage lung disease and their families. And after the evaluation process, the transplant procedure itself, patients can be in the hospital for a month or longer. They need to be close to the transplant center for several months following the procedure. And so it can be quite taxing again on the patient and their family to come back and forth to the transplant center. So I'm new to this area, but what I heard previously was that because of the difficulties, a lot of patients who would otherwise be good candidates just went without and actually did not get the procedure. And those that did, again, it was very difficult for them and their families. So I think having this program here really opens up a lot of opportunities that would otherwise didn't exist for patients with advanced lung disease.